Premier Horgan, you mentioned at the beginning that there's still a reluctance from some to come to a reopening. How does the province ensure that there's not tension between those that are, ready to get moving on to the next step and those who don't want to move on? And to Dr. Henry, I'm just trying to get a sense of when you ease these restrictions, like something like gyms and high intensity classes, are all the other policies still in place, like masking? How do those sort of measures work?
Well, broadly speaking, how do we deal with anxiety in the community is something I think most of us have been listening to for quite a number of months. We need to be kind, we need to be calm, and we need to ensure that we keep ourselves and those around us safe. Those three directives have served us all very, very well, and that will help us as we move through step 2 into step 3 later in the summer. The vast majority of British Columbians are anxious to put COVID-19 behind us, but we've learned a lot over the past 16 months, and one thing that stands out front and center is we cannot predict what this virus will do. We can behave in a way that will reduce transmission and keep people safe, and that's following the orders through step 2 and respecting that not everyone is at the same pace. Not everybody wants to get back to a filled arena to watch the Canucks or to go to a massive concert, but a lot of people do. And I think people will vote with their feet, quite frankly. They're going to go to events that they're comfortable at, and they're not going to go to events that they are not. And those are personal choices. Government can't dictate those, but we can follow the sage advice of our PHO and be kind to people and respectful. And be calm when others may not be, and most importantly, make sure that we keep each other safe. And I'll ask Dr. Henry to talk about any other issues in that question.
Yeah, so we are doing this, as we talked about, incrementally, which means that we're still relying on our COVID safety plans, the ones that we've had in place and we've modified over time. So things like high-intensity fitness, they still have to have reduced numbers, COVID safety plans in place. Same with the events, the organized events. The numbers are 50, but that means we go back to having that plan where you make sure you know who's there, that you have the right things in place. But we can open up a little bit more. We can get back to where we were when we had more people involved. But all of the same safety plans that are in place in restaurants remain in place for this phase. This is 2 weeks. This is gradually increasing our connections, our connectivity. And as the Premier says, we need to be mindful that not everybody's in the same boat right now. If we have people who in our family who are going through cancer treatments or elderly people who are not yet comfortable, it's okay to say no to going to that family gathering or putting off a little bit longer, getting together with friends or others. So everybody has to step back and take a look at where they are, but we need to also continue to follow the rules in those places where we're going to our fitness class for the first time in a while to make sure that we can do it safely and we can gradually get back to full opening, hopefully very soon.
I'm just wondering about what is possible that could make us have to step back again. You asked about the UK, and I'm looking at their percentage of vaccinations for first dose is about the same, second is greater. So is there something that could make us hit a wall and have to step back?
Well, I'll start with that before I invite Dr. Henry back, Lisa. And again, we have charted our own course from the beginning, obviously mindful of what's going on in other jurisdictions, learning from those experiences. But we have been thoughtful and methodical about this plan. There was a lot of push to have us open earlier than we were ready to do so. Once we laid out the plan for the course of the summer, Minister Callon, Minister Mark met with industry tables, very excited about having a way forward. What I heard more than anything from businesses, from not-for-profits, from regular people was the uncertainty that they felt about their future. And anytime there's uncertainty in someone's life, that causes anxiety and tension. Having a path forward, having a step-by-step process to safely get back to where we all want to be was widely regarded as the best way forward. And we're going to continue to take our own counsel, but of course be guided by the things that we see in other jurisdictions. One of the issues that we talked about today was we want to make sure that non-essential travel from other provinces, for example, remains in place. And we're going to continue to monitor that with my colleagues across the country, as will Dr. Henry with public health officers in those jurisdictions. But I'm confident that we're on the right track, provided we follow the advice and the guidance. We continue to do the things that we have been doing to get to this place. I'm certain that we can carry on to step 3 and then later to step 4 as the summer evolves. But Dr. Henry can do a deeper dive on that for you.
Yeah, I absolutely agree. I mean, I think the things we've learned are that there's always things that are unknown. I think, as you called them, the bricks to the head. So we are watching really carefully. And as I said last time, this is a stepwise progression, and we're letting the data speak for itself. We're working on making sure that our public health teams are able to manage every case. And, we think about it, we've spoken to over 145,000 people in British Columbia who've had COVID-19. We know a lot about this virus. We don't know everything, but we can look at what's happening. We look at the rates of immunization in different age groups, where we see transmission, the things that we put in place that make a difference for transmission. And so I don't expect with what we know now, we'll have to go back, but we may need to slow going forward, depending on what happens. And this next couple of weeks will be very key for that. And right now, the public health orders are still in place. So all of those things, other than the changes that we've made today, are still in place. And we'll be looking, as we get closer to July, about how we can lift those orders. And that would be the next step, is to actually get out of the orders entirely and just have those guidance that can help us get through this next step. But we'll be watching the data. We're doing whole genome sequencing on every case, as I mentioned. We're actively managing with people every single case and finding out where the transmission happens so that we can keep a lid on things as we move through into this next phase. And the modeling I showed last week, it's likely we will see an increase in numbers of people infected with the virus as we start to come together more. And so that's where we have to find that balance about the things we need to do to be together and our own personal risk and our own personal comfort levels. And some people won't be ready to do that for a while because there is still a risk in our communities right now, but we can manage that risk. We can live with this virus and still get back to those things that are so important in our lives.